said, I'm newer here. I was started about 6 months ago, and I work in the Center for Community Health Strategies, which is a really great place to work here. I think a lot of the people that you've been hearing from have talked a lot about some of the mandated services that we have here at the health department, which is a lot of our services. And CCHS is really cool because it's not a mandated service, but we do a lot of community outreach, a lot of relationship building, and it's really that piece of public health. So I guess I think back to our slogan, which is to serve, protect, and promote health for all. And I feel like CCHS is really that focus on all. So it's really engaging community in kind of in this collaborative effort to work toward bettering our communities, and which is a really awesome and challenging place to work because you know, it's not as, I think, I'm trying to think of the right word. I think it's not as straightforward. There aren't always like right and wrong answers to everything. A lot of it is, you know, you're learning as you go and you're developing these relationships and really relying on the people around you. And so I really like that aspect of it. It's been really great working here so far. A little bit about how I got here. So I started, let's see, so I went to community college at first because I didn't know at all what I wanted to do. And then I went to Calvin College because I was really interested in public health, and that kind of developed throughout my high school and like early college career. And I was really obsessed with health, but I didn't know like to take a clinical side of it, or I was really fascinated because public health is so broad, and that was what was really cool. There's so many interesting topics, and so I graduated there, and I was really interested to get in and have a lot of hands-on experience. And what's great about Grand Rapids is there's so many different organizations that are really excited about interns and really want to help you grow and learn and develop in your professional career. And so my first internship was at Calvin College because at the time I think there were like 4 or maybe 5 public health students, so it's really cool to see like a whole like room full because like I think our graduating class got like merged with nurses or something, so it's really cool to see that everyone is interested in it. But it was to create other internships for other interns, and that was really cool because I think in public health sometimes you have the flexibility to see where a gap is and kind of insert yourself and really figure out how to navigate creating opportunities for others or yourself inadvertently. And so that was really awesome. And then I started to have a really big interest in harm reduction, and I still do. I think it's a really awesome topic in public health, this kind of concept that not all organizations are in line with, where you're not necessarily telling someone or a group of people to stop doing a certain behavior, but how to do it in a safer way. And so I was really interested in that, and so I interned at Red Project, which I don't know how familiar all of you are with them, but they do really amazing work in drug overdose prevention. They also do some sex education. They did a little bit when I was there. They have needle exchange programs, and so that was really awesome, and I spent quite a bit of time there. I think there were a couple other ones, but I really dabbled in a lot of different areas in public health with internships, and I think that was really good if you're thinking about your own careers, whether you're pursuing additional education. I think having experience is really awesome, whether you're getting paid for it or not, which is hard sometimes. But so I did some stuff in refugee resettlement at Bethany, and all of these were really great experiences. They were all a little bit different, which was tricky trying to like apply for jobs and things like that because you have all kind of a broad experiences. But I
liked it. I was on the hiring team.
Yeah, okay.
I was like, oh, look at all the places she's worked. They're so cool.
Yeah, that's just what's really cool about public health. You can take so many different avenues with it. And so the first public health job that I took, I worked in more of a clinical setting at Planned Parenthood because I was really interested in education. And that was a really great experience to learn a lot, kind of continuing harm reduction as well, and get more knowledge on how to educate and relate with people. So that was a really great experience. And so kind of going from there, how I got involved in the health department was I kind of wanted to get back to more the education piece of it, the more community engagement side of it, because I'd been doing mostly clinical stuff before. And to me, like, the health department is kind of like the shining beacon of that. They really have so many different, programs, and there's so many different avenues you can take when you're applying to a health department. And so I applied for a health education position. I kind of browsed on and off and looked for them. So what was really great in that kind of process of finding a job here at the health department is it was really easy to kind of find different opportunities. I felt like they advertised it well. And so I was just really interested to work here. I felt like it aligned with, what my core values, and so I, applied in a very long process. I started here, and it's just been really great. I think something that I didn't really realize about the health department, I guess, is just how much they do. I think, I don't know, maybe if it was just my own, lack of research and understanding, but like working here and talking with the people who provide services, there's just so much available, and so many different opportunities to work, volunteer, and be an intern. And so I think that's been something that's been really cool. I think something that stood out to me just in the last couple of months that I've been here is seeing the interns that work here, and just the process that they go through to get an internship here. And it seems like they all really have great experiences, and they glean a lot from their experience, but also that they kind of go through an application process when they apply to be an intern here. So they have an interview process, they write cover letters and things like that. And that wasn't something, I don't know if it was just my personal experience, but I didn't have to do that for my other internships. It was more so about relationship building and kind of finding those opportunities. And so I thought that it gave a lot of young professionals really great, like, real life experience. And because oftentimes, at least for me, the interview process is something you kind of learn on the fly, and you learn from your own mistakes. So it was really cool to see it kind of done in that educational environment. And then something that I wish everyone knew about the health department, trying to think. I think just that difference between the mandated services and the non-mandated services. So like I mentioned earlier, that's something that, I feel really lucky to be able to work in that arena, where it's not necessarily mandated, but it's extremely important. And I think that's, when you're thinking about public health, a lot of times when things are service-based, we aren't always able to kind of look at this bigger cloud of like, okay, well, why do people need these services, and what do we do to kind of address it at a little bit higher of a level of, so maybe preventing people from needing services in the first place, or thinking about things that might be unique barriers for people being able to access services, or why aren't these services recepted well. So I think that's a really cool part. It's been really challenging, but I've definitely learned a lot. And I also really like about the health department is it seems like everyone's really dedicated to kind of really learning to grow and adapt. I think even when I was in school, a lot of, I don't know, it was, you learn kind of one set way of doing things, and I really appreciate that the health department has really kind of evolved with, the ways that we address public health, like this, for example, of, really shifting to community to engage and like help us identify, where it is that we need to work and help identify gaps. So that's been what that's all, everything I think I've touched on. Does anyone have any questions or thoughts?
I have a quick plug too, as you think of a question. So I didn't ask her to say this, but the internship mentioned. We do have an internship program that I manage. It's every semester, including spring, summer. So we just opened the application period for the winter. It's open through November 7th. You just Google Kent County Academic Health Department, it'll come up. Those internships are from January to April. Depending on the internship, they can be super flexible. So I've had interns in the past that have needed only 5 hours a week. I've had interns that needed 20 hours a week. So that's something you can kind of maneuver. I would need to look. I know Paul is partnering with someone, John West, on a lead data. So if anyone's doing epi stuff, that might be a good idea. And basically looking at how to analyze some of our lead data so that we can get down to more racial and demographic information, so we can show if there are disparities in that kind of area. There's a lead communication intern. There's just a general public health intern that would be housed in CCHS. So Brian Hartle, who is an amazing epi and supervises the area that we're in, he's overseeing that internship. There's a substance use disorder website that needs some maintenance and some just like checking resources that's posted. And then finally, for the health educators, it's called Life Skills Parent Program. So it's another substance use related, I think, program, but it's really thinking about how to work with parents on that topic. So pretty exciting internships. Like I said, you would have to apply by November 7th, but all the instructions are online if you're interested. And then one other thing, just to tie into what Olivia said about mandated versus non-mandated services, and I think you hit on it really well, that when something is mandated, so and Carla touched on this too, like if you are giving immunizations, that is your job. You are looking to get shots in arms, and sometimes there's background work that needs to get done in terms of making sure you're publicizing it, recruiting appropriately, depending on what populations you work with. But oftentimes you are kind of nose to the grindstone doing this thing. We are very lucky in that we get to like stop and say, okay, we don't have to do that every single day. We can take a second to think about, you know, why are we having a really hard time getting immunizations in this area? Why aren't people coming to this clinic that we thought was centrally located with bus stops, with all these resources that should make it accessible? And so we can kind of pause and help support some of those programs by saying, okay, we actually just learned that the DeVos Place, for example, is not an acceptable location for these populations for whatever reason. So what is an acceptable area? And a lot of times those answers are not coming from us. So this used to be and still is, stemmed out of the HIV epidemic, but nothing about us without us. So it's like, if you're working in community, you have to be talking to community, because otherwise you'll do stuff. And DeVos Place was incredibly successful, as Carla said, targeting many, many people, but there were certain populations that just were never gonna go there. And so in talking with folks, we were able to say, okay, so actually in these communities, it's churches, or it's grocery stores, or it's a mobile clinic, or it's this very specific community-based organization that has a ton of trust, but if we try to go even a block down the road and do it someplace else, they're not gonna come. And it really is working with those CBOs to have them promote it. And so I think a lot of what we do too, and we have been talking about it more and more, in relation to Olivia's work, she's the health equity coordinator. Something that we talk about a lot is how do we make sure that we as a health department, we always say we want to be in the background, but then we're the ones presenting, we're the ones doing all this public facing work, which is exciting, but also like, why can't our partners do that if we can compensate them for it, of course. But how do we actually step back? And that's something that is, I think, a big shift when we talk about like power differentials and stuff. So we're kind of exploring what that looks like. Now I will stop talking, but if you do have any questions regarding, you know, the internships, anything that Olivia has shared about her trajectory, we're happy to take those now.
I guess just like, how much do you work directly with community and community partners? Is it mostly nonprofit? Is it, you know, like what kind of experience do you have in the Kent County community? Is it usually centrally located, or do you go kind of all over?
Yeah, so it kind of depends. A lot of it is community-based organizations. I don't do as much with like our health systems, so usually those are other people on our team, but we do kind of cross paths. But a lot of it, so sometimes it is I'm going to their organization, getting to know them, or we're talking about a project or something that they are working on. For an example, we're working on a health equity council right now, and it's really about kind of gathering a lot of different partners who are all invested in community health and bringing them together to really ensure that our efforts are focused on community voice, and community voice can be a lot of different things. So in this case, it's community-based organizations, people who know the communities that they work with really well and can kind of attest to those priorities. And then also community members or residents, so people who, you know, live, work, play, worship. They're not necessarily affiliated with an organization. So I got lunch with one of them today, and thought, you know, we had a lot of conversations, mostly just about our lives, and it was a lot of relationship building and just talking to her and seeing if she wanted to participate on, you know, this council. And so a lot of it is really, I feel like for me, kind of shifting the way that you communicate. I think a lot of times, especially if you're in a specific field, you're learning almost kind of like a whole new language, and you kind of have to shift that around depending on who you're talking to. And I think that's really exciting. And so I guess to answer your question, it kind of just depends. I'd say, like, I mean, I've been here 6 months, so like the first 3 months were like just a lot of listening and observing.
Yeah.
A lot of that. So, but I'd say like, I mean, on a daily basis, usually we're meeting with somebody remotely, and then like once a week, it's usually somebody in person, and it kind of just depends on the relationship and what we're working toward together. But I do really like the in-person piece of that. I think I feel really fortunate that I get to do that as part of my job. So that's a big piece of it. So trying to think I haven't really met with a lot of kind of, I guess, non-traditional partners, people that aren't, I guess, directly involved in public health or that are community members. But I know that's something that long-term that we hope to kind of develop more of those relationships. So I'd imagine that would kind of be on the horizon too.
Okay, cool.
So we've actually, in relation to the Health Equity Council, we've talked about, so we have a community voice group, so that's residents, that's CBOs, and then there's also a kind of community stakeholder group, I think are calling them. And that could include academia, that can include funders. So when we think about, one of the biggest issues in public health always is sustainability of funds. So, and there's actually a lot of issues, but another issue is that traditional grant making doesn't always take into consideration community voice. So they're just saying, like, for whatever reason, our foundation, our division, our department thinks it's really important that we do a diabetes prevention program among whatever population. There's usually like stipulations. And that's great that they want to fund that, but oftentimes you might be going into a community and they're like, yeah, we just told you in a survey 6 months ago that our biggest concern is neighborhood safety, and now you're coming to us with this diabetes prevention program, and it's like, do you listen at all? And that can erode trust. So you have to be really mindful of how you're bringing grants in, and then the flip side of that is you find a perfect grant, it aligns very well with what they want, and it lasts for 5 years and then it's gone. And so we're constantly on the prowl. We right now have this really amazing program, Community Connectors and Navigators. The navigators are associated with CBOs, they're embedded in the CBOs, and then the connectors are unaffiliated, just residents. And they've been helping us get communications out, I think I mentioned it earlier, communications out about COVID, but anything, so monkeypox, anything that comes up that we have to get quick messaging out about. And that funding ends in June 2023, and we are very stressed about it because it's been so valuable, and the people involved are still excited to be involved. So that's a big piece of it too, that whatever is happening is working in a way that they feel like they're being heard, that they're getting information that's valuable for their communities, they're getting resources, they know when we have masks, testing kits, vaccine clinics, whatever the thing is. And so a lot of our work too is, to circle back, is how are we presenting this to local funders? And in the past, we haven't really. In the past, we've relied mostly on federal and state funds, but I think it's becoming more and more apparent that like there's also opportunities, especially if you do want sort of a non-traditional grant. So that could either mean that it doesn't have a traditional cycle, maybe they're willing to sustain it for longer, maybe with less money, something like that, or they're not mandating metrics on the front end. They're not saying you have to tell me the decrease in diabetes, decrease in STIs, let's say, over a given period, or unintended pregnancy. Those are really like traditional kind of public health metrics. But when you're talking about population health change, it takes a very long time. It's not easy to measure, especially when you're like dealing kind of in the area we are, where it's mostly like trust building, connections with different groups, trying to deduplicate efforts, trying to use money better. Those are really hard to measure, and they're not things you can be really successful at right away, especially like we're a governmental entity. We're working in communities where there might be high populations of undocumented folks. There's historical trauma that is feeding into their perception of us. And so we're already kind of starting from a point where we have to really work to build that trust. So it's just gonna take time. And I think when you talk about trying to engage with community members, like that's not an easy thing to do. I think people think you can just walk outside and be like, we need help, and people will be like, great, we want to help. And that doesn't work that way. Like you really have to rely on your CBOs, and you have to, over a ton of time, build relationships so that community members realize you're listening to me, you're paying me for my experiences, you are making changes based on what I said, I'm seeing that. Basically I'm just not screaming into the void. I'm not just coming and telling you stuff and you're like, great, sounds good, and then nothing ever happens. I don't know why I got on that path, other than, academia is very important in that space too. So understanding how can we work with students to really maximize the things we're doing, whether that's, we have so much data, like could we partner with some academic institutions to get community one-pagers so we can say to the community, yes, we were here, we did a survey, and not only do we have like a big report about the county, we have something for you that you can take to a funder to say, look, this is a problem here, I have data to support it, everyone wants data. Even if they're doing the same survey 65 times in the same area, that's a different thing we're trying to figure out. And so, yeah, it's just really important to have all these different relationships to see like where can that, I hate this word, but where can that synergy happen? How can we not duplicate efforts, not work in silos constantly? And it'll happen just because that's the nature of things, but there are opportunities for us to really work well together, so.
Well, and to bring it full circle too, I would just say that that's why we're here, right? That's why we saw our next strategic long-term partner in Kent County, in you guys, because we are doing a lot of collaborative work and a lot since the onset of our program and before. Like I walked in this room today and I said, oh my gosh, I came and spoke to your whole health department more than once before our program even existed in here. And so we've been very closely tied with all of you, but not formally. And so like that community one pager, you know, that's conversation for tomorrow morning or Friday morning's meeting, right? Our meeting that we have on a monthly basis where we talk about this partnership and what it means to our classrooms and how, you know, our next class, what we'll be doing in the next class. And so we're formally planning for some of that. And so to hear you say that, it's in my head now because it'd be a perfect classroom assignment. And that would be, you know, and you could do it on multiple topics and small groups or individual assignments, and we could get you 30 of those in a matter of weeks in the classroom, and it would be an incredible experience for the students to put that together.
And it would be so useful for community. The Johnson Center at GVSU, they
Sure.
host a community, it's called Community Insights. You guys should take a look at it if you haven't. Really cool platform. But they used to have neighborhood one pagers that were not updated automatically, so it was like a pretty static thing they did every couple years. And there was this big shift over in their software platform where they lost those, and he said that even though the ones that people were using were from like 2016, he still gets calls weekly, and it's because you can give people raw data until you're blue in the face, but that if they can't, a lot of people can't do anything with that. So like you're giving them census data, you're saying, oh, this tells the story you're looking to tell, and they're like, no, it doesn't. That is an Excel sheet. And so figuring out ways that we can put it in a like one pager into infographics, like that's all going to be super useful for people.
For sure. It's exciting.
Not
Not
much.
much.
We have about 6 minutes. We can wrap